Hello, I'm Dr. Sara Williams here in the UK. Many people assume that if a medication is commonly prescribed, it must be safe POF. Every week, I see older patients dealing with serious side effects. No from rare, not from rare, but from medical drugs. What makes this more concerning is that many of these problems are mistaken for aging itself, when in reality, they're caused by the treatment meant to help. Today, I want to walk you through 5 commonly prescribed medications for people over 65 Fiev.
Some of the most frequently prescribed medications for older adults are also among the most harmful, yet patients are rarely fully informed about the risks. If people truly understood the potential dangers, many might choose to avoid them altogether. Hello, I'm Dr. Sara Williams, and welcome to my channel, where I analyze and challenge medical and nutritional misinformation. In today's video, we'll be discussing insights shared by Dr. Sil Dant, an internist with a large online following. I am also an internal medicine physician with a background in lifestyle and metabolic health, so I am very familiar with the medications being discussed. Please stay until the end, where I'll share my final thoughts and practical guidance. Over the years, I've witnessed countless complications related to commonly prescribed medications, and many doctors would say the same. The first medication we're discussing is a diuretic used to treat high blood pressure, commonly prescribed in the UK as Benadryl. Why am I concerned about this drug? I've seen numerous cases of dehydration, but the most frequent issue is low potassium levels, known as hypokalemia. A very common scenario in hospital involves someone over the age of 65 who has been unwell for a week or two but continues taking this medication. As dehydration worsens, potassium levels continue to fall. By the time we test them in A&E, potassium levels are often below 3.0, sometimes 2.8 or even lower, while the normal minimum is 3.5. This is not uncommon and can be dangerous. When diagnosing high blood pressure, clinicians are generally advised not to rush. Unless readings are extremely high, blood pressure should be measured over several visits. Patients should receive lifestyle advice and return for follow-up after a few months before medication is considered. However, because benadryl is inexpensive, it's often prescribed quickly as a first-line treatment, rather than allowing time for lifestyle changes to work. My approach is different. I strongly favor prescription-strength lifestyle interventions, particularly dietary changes, before starting lifelong medication. For many patients, especially those who have weight to lose, blood pressure improves significantly with diet alone. With approaches such as low-carb or ketogenic diets, many patients can eventually reduce or stop blood pressure medication altogether. Low potassium and dehydration are extremely common with this drug and can lead to weakness, heart rhythm problems, and hospital admissions. Even when monitored in the community, patients often need potassium supplements or dietary advice. Given the range of safer alternatives available, this medication would not be my first choice. Doctors often advise patients to eat potassium-rich foods. Bananas are the classic example. But for those following a low-carb diet, bananas aren't ideal. Potassium is readily available from leafy greens and other vegetables, but ideally, patients wouldn't need supplementation at all if the medication were avoided. The second medication is Gabapentin, also known as Neurontin, commonly prescribed for nerve pain. I've lost count of how many patients I've seen admitted to hospital while taking extremely high doses, 600, 900 milligrams, 2 or 3 times daily. The usual starting dose is around 100 milligrams. Over time, tolerance develops, requiring higher doses. One of the most concerning side effects is excessive drowsiness. When patients are admitted and the dose is reduced, families often comment on how alert their loved one suddenly becomes. In older adults, drowsiness significantly increases the risk of falls, fainting, and injury. While gabapentin can relieve pain, it often does so at the cost of over-sedation. It's well known that medications tend to cause more side effects as people age, which is why we always review them carefully in older patients. Gabapentin is frequently used for pain management, but it can also contribute to weight gain. From a metabolic health perspective, We routinely screen medications that may lead to weight gain, and gabapentin is one of them. This doesn't mean it can never be used, but it helps explain unexplained weight changes. At this point, I'd like to thank Element for sponsoring today's video. Element provides a balanced mix of sodium, potassium, and magnesium, particularly helpful for those following a ketogenic diet. Their raw, unflavored version, marked with a teal label, contains no sugar, no stevia, and no additives, just clinically measured electrolytes. Electrolytes are essential, especially on low-carb diets. You can get a free 8-pack sample with any purchase via my link. Details are in the description below. Thank you to Element for supporting the channel. Medication number 3 is high-dose anti-inflammatory drugs, known as NSAIDs. A common example is ibuprofen, which is available over the counter, but there are stronger versions such as naproxen and diclofenac. These medications are often used for conditions like arthritis and can reduce inflammation effectively. However, long-term or high-dose use can cause serious problems. A frequent hospital scenario involves patients presenting with stomach pain or vomiting blood. On investigation, they've often been taking high-dose NSAIDs for extended periods, resulting in stomach ulcers. Another serious risk is kidney impairment. As with all medications discussed, these drugs are sometimes appropriate, but dosing must be carefully monitored, especially in those over 65, where complications are far more common. Pain relief is important, particularly for chronic conditions. Interestingly, many pain specialists now incorporate low-carb and ketogenic diets into their treatment plans. These diets reduce inflammation and have helped patients reduce reliance on opioid and pain medications. Carbohydrate-heavy diets are inherently pro-inflammatory. Many patients experience not only weight loss and improved blood sugar control, but also meaningful reductions in joint and chronic pain. If you've experienced improvements like this, let us know in the comments. Medication number 4 is Flexeril, known chemically as cyclobenzaprine, used for muscle spasms. While commonly prescribed in the US, it is less frequently used in the UK. I've repeatedly seen cases of excessive sedation, particularly in older adults, leading to falls and injuries. Muscle spasms often have underlying causes, such as low magnesium levels. Addressing root causes or improving diet may reduce the need for such medications altogether. The 5th medication is Benadryl or diphenhydramine, a sedating antihistamine often used for itching or rashes. Even in younger adults, it can cause significant drowsiness. In people in their 70s or 80s, the sedative effects can be profound. Fortunately, non-sedating antihistamines are widely available and generally safer. To summarize, my least favorite medications for adults over 65 are bendroflumethiazide gabapentin NSAIDs, such as ibuprofen, naproxen, and diclofenac cyclobenzaprine diphenhydramine. As we age, it becomes increasingly important to evaluate every medication carefully. Benefits should clearly outweigh risks, and alternatives should always be explored. Finding a doctor who prioritizes lifestyle-based care can be challenging, but organizations such as the Society of Metabolic Health Practitioners and the Obesity Medicine Association can be useful resources. Many medications, including steroids, insulin, nasal sprays like fluticasone, and gabapentin, can contribute to weight gain. Identifying these helps patients understand that weight changes are not always their fault. I agree with Dr. Dant's central message. Medications can be too strong, overused, and particularly risky in older adults. Please remain vigilant for yourself or your loved ones. If you found this video helpful, please like, subscribe, and turn on notifications. New videos are posted regularly. You can also support the channel through membership or PayPal. Links are in the description.